Hello, my friends. My name is Mac Camacho, and in this video, I am going to talk to you about faces and skulls from infants to teenagers to adults and elderly people. Now, if we look at the vertical fifths, generally speaking, between the nose, that's one vertical fifth in the middle. And then if you look at the eye width, that is the same as the width of the nose. If you carry that out to the side of the head, in children, that last vertical fifth is actually the side of the head, not including the ears, whereas in adults, that last vertical fifth actually includes the ears. So there's a slight difference. Now, what we have here are the horizontal 1/3 in adults, and for babies, it is the horizontal halves and quarters. Let's start with the adult first. You can see that the hairline down to the glabella, which is the most prominent part of the skull here above the eyes, that is 1/3. Then from the glabella to the bottom of the nose, which is called the subnasale, that is another third. Then from the bottom of the nose or subnasale down to the bottom of the chin, which is known as the menton, that is another third. And those tend to be about the same in adults, and there's a lot of variation, but in general, that is what is considered the average adult face. Now, when we look at a baby, you can see that the skull is much different. The top half is the cranium, which starts at the glabella or the superior orbital rim in this area above. That's half of the skull. And then below that down to the chin is the second half of the skull. And then we have other areas between that are divided into quarters. You can see the first quarter is below the eye. This is the infraorbital rim. That's just below the eye. The subnasale, again, is below the nose. That's another quarter. Then you have just above the lips. That's the next quarter. And then the chin makes up the last quarter. And here you see side by side the skull and the baby's face. And as a child gets older, the face becomes more rectangular. This is a teenager. You notice they're starting to develop more of the trapezius here in the neck. You can see the sternocleidomastoid, this little V that comes down here in the middle. Start to see that a little better. You'll start to see more adult features. If you look at the skull, it looks a lot more like the adult. In fact, usually by the teenage years, kids tend to be almost to the adult growth as far as the skull is concerned. And then as you get older, this gentleman's probably 45 or so, maybe 50, you'll notice that there are static wrinkles on the top part of the forehead here. Even when he's not smiling, you will see those. There are crow's feet, which are the side ones here, and those can become more prominent. The dimples and the fold along the side of the lips here, between the lips and the cheek, that gets deeper. And then you will notice the skull is pretty much the same as it was for the teenager. Here's side by side. Here we have a gentleman who's probably about 60, and what you'll start to notice is a lot deeper wrinkles. You'll notice on the side of the eye there's raising of the eyebrows. This is because fat in the face, fat from the lids, the tear gland, the lacrimal gland on the side of the eye here, above the eye, can start to come down. The skin starts to get looser. In order to be able to see clearly, you have to raise your eyebrows in some cases. You also get more fat underneath the eye, wrinkles under the eye, deeper wrinkles as far as on the chin, the side of the cheeks here. The ears start to get longer. There's more wrinkles you'll notice in the neck. There's these vertical or straight up and down lines here under the chin. Those are from a muscle known as a platysma. That muscle starts to separate, and you'll see that gap start to get deeper. And you may start to notice more prominent blood vessels or muscle bands here in the neck. Next, we'll look at an older gentleman. Another thing you can see is hair loss, right? Some people lose hair early. Here we have a gentleman who's probably in his mid 80s to early 90s. You see the hair is almost completely white, even longer ears and earlobes. The tissue in the nose is getting thinner, so you start to see more structures. You notice below the eyes, the fat and tissue starting to herniate or come down. The tissue above the eyes is starting to block the field of vision. So some people will have what's known as a blepharoplasty when they take some skin off, and sometimes a brow lift to help you see better. Not even necessarily for cosmetics, just in order to see better. You see the prominent vessels here on the side of the head as the skin becomes thinner. You notice a deepening of the gap here in the neck, the platysma, separates even more over the year, so you get it to look deeper. Then you get some prominent vessels in the neck. Additionally, those jowls have really started to come down a lot more. And overall, you can just tell that he looks older. There are other features that you may notice. The chin is actually becoming less wide. The jaw is less wide than it was, and I'll show you. Here you can see that the jaw is actually set higher because the jaw has started to recede. What's interesting is that if you look at the eye socket, it starts to get a little wider because the bone starts to absorb over the years as you get older. Additionally, the nose, where the nose sits, that opening also gets a little bit wider. And if the person is wearing dentures, you get even faster absorption of the jaws. So here we have a side-by-side showing the skull on one side and the face on the other.